Welcome, everyone. We are so excited to have you guys here with us today. Welcome. Let's see here. We are so excited, so excited. I know that PA Jennifer Jordan is super pumped to chat about Sculptra today, and we cannot wait to talk about how revolutionary this is. It's been around forever. But you know, it's a staple, and you gotta get in there, laying the foundations. Let's see. So we're gonna give people just a moment to jump on here. I am gonna preface this before we get started. We'll talk about it at the end. I did want to say that the lovely PA Jennifer Jordan, who is hosting this with me today, practices at our Pflugerville and Steiner Ranch locations in Texas, but we do offer this throughout the multiple locations we have in the Central Texas area, which would be Bee Cave, Central Austin, Dripping Springs, North Austin, Pflugerville Steiner Ranch. We also have a location in San Antonio, Dr. Finder, and then as well as at our Baton Rouge location in Louisiana and our Uptown location, which is in the New Orleans area. So we do offer this service at a wide range of locations throughout the Texas and Louisiana territories. So if you have any doubts about where you should go, definitely check out SanovaDermatology.com and go to our locations page and find the location nearest you, and they can help you figure out where you should go. But we've got amazing, extremely talented expert injectors like PA Jennifer Jordan here, who would love to help you on your Sculptra journey. So we're going to give just one more second, and then we're going to get this party started. Are you ready, PA Jennifer Jordan?
I am. How are you, Taylor?
I am so good and so excited. Again, my name is Taylor Butler, and I work with Sanova Dermatology, and I'm going to be co-hosting today with the lovely PA Jennifer Jordan from our Pflugerville. We can.
Did you hear my little rasp there? It's my webinar voice.
Oh, I love that. I love your webinar voice. Something tells me that
a few little allergies have settled in, so y'all hang with me. But for those of you who know me, it's me. It's me. I just sound a little funny.
That's okay. I mean, I think that we've all in Texas felt the lovely joy of those spring allergies. Okay, let's go ahead and get this party started. I'm going to start the presentation now so we can get going and you can learn about the exciting Sculptra aesthetic. I cannot wait. Let's see here.
Let's do it.
Okay, can we see my screen?
I am able to see it. Yes, sir. Thank you.
Perfect. So like we said, we're talking about Sculptra aesthetic today, and we felt it very fitting to talk about this as laying the anti-aging foundation. And we'll get into a little bit more as to why it's considered the foundation of anti-aging. But first, like I said, we have the lovely and talented Jennifer Jordan, physician assistant at the Pflugerville and Steiner Ranch locations. And hello again, Jennifer Jordan.
Hey, Mr. Taylor. All right, let's get started.
So excited. Okay, so before we can start talking about anti-aging, let's talk about aging first. So tell us a little bit about aging.
Right. So I love this split face, this mother-daughter, because, I mean, my goodness, they're practically twins. It kind of shows where we're headed. And if you look, you can see, you know, the subtle changes that happen from when we're in our 20s, you know, and then progressing forward. And so subtle things that you're noticing, you can see that with time, you get fullness in the lower face, you get the drooping under the eyes, you get the fullness here, but it's really dramatic when you compare the split face. You know, so again, pointing out like the typical youthful features, you know, when we're young, our skin is smooth, you know, there's not these deep wrinkle folds, our skin color is even, and we've got, you know, high cheekbones, cheeks are full, but there's a really nice defined jawline, and our fat pads are nice and thick. And there's great, you know, kind of lower bone structure. And so, you know, these are things that you see on a youth face, you know, these things. And then again, as we age, you know, we get these set in lines from facial movement. There's, you know, sunspots, which again is why I'm, you know, preach to my girls to put on their sunscreen. But you get little broken blood vessels. And then you can also get like the heaviness in the cheek area, as well as the cheeks will also kind of flatten. So some people will notice that they no longer kind of have that high cheek, but rather it's kind of flat on the side and it kind of slides forward. You get that sagging jawline. And then of course the horrible double chin, that fullness under the chin.
What a gift.
I know. Well, you know, and the thing of it is that, sorry, Taylor, go back one more time. And they show it as kind of a triangle, but the other thing that can kind of happen is that rather than your face sort of being sort of the other triangle, sort of the inverted triangle, your face can also look sort of square, because as things kind of slide down, you get kind of heavy in the lower jowls. And so they're showing a triangle here, but I also notice sometimes patients look very square. So there's, you know, different causes, you know, to aging. We talked about, you know, sunspots and things like that, but like, you know, the muscles that are under our skin, you know, for me, it's furrowing my brow at my girls, you know, anybody who's got teenagers understands this, right? But it's those lines caused by repetitive muscle movement, the forehead lines, you know, the smile lines you get around here, as well as like the little bunny lines that you get there. Those are lines that you get from repetitive, you know, motion, muscle movement. And then you can see here, it's really obvious when you look at the youthful face and the daughter's face, you can see that, you know, her deep and superficial fat pads are all, you know, nicely, you know, put together kind of like a puzzle. And then you look on the mom's side and you can see that the fat pads sort of shrink, or excuse me, they shrunk and they shifted. And so there's spacing, and that contributes to some of the hollowing that you see under the eye, the loss of the fullness, the wrinkles and the lines around like the nose and the mouth, you know, the sagging along the jowls, as well as kind of that, you know, fullness in the chin. But it's, you know, it's just kind of what happens. Our deep and superficial fat pads, they shrink and they shift.
So you talked a little bit now about the aging process. So tell us how collagen plays a role in that process.
Right. So collagen is this kind of flexible fiber, this protein that basically gives structure to our skin. And it basically helps to support all these underlying structures. And what happens is, as we age, we lose collagen. In fact, you know, there's a large percentage of our skin that's made of collagen, and it's this like scaffolding or support structure that helps to maintain skin shape. And you know, skip one forward for me, Taylor. But the really, really sad truth is that like we really start losing collagen early. You know, some studies suggest 18, some suggest 20. So, you know, in our very young years, we start losing collagen, and this accelerates, you know, with menopause. In fact, you know, there's a significant amount lost after those first 5 years of menopause. And around age 50, you can have lost up to 30% of your collagen, which contributes also to kind of that sagging and the draping of the skin. It's no longer supported and lifted. You know, there's other causes too, right? There's genetics, and then there's sun exposure and smoking and stress. You know, there's studies that talk about like, you know, stress levels can cause breakdown of collagen, but then there's also, you know, pollution and free radical damage. There's many reasons as to why we lose collagen.
Sounds like quite the fight we're in right now.
It's terrible. It's terrible. Yeah. And honestly, it's one of those things that like, you just kind of wake up and you're like, oh my goodness, what has happened? Yeah.
Okay, so tell us about what our options are for kind of dealing with the collagen situation that we seem to be in.
Right. So I think everybody is familiar with, you know, skincare options, you know, obviously like topical vitamin C, that's one of my favorites. I love SkinCeuticals, CE ferulic. When applied topically, it can help to stimulate collagen. You know, there's studies that talk about topical peptides help to stimulate or signal, you know, the skin to repair. They help to boost collagen production. And then retinoids, you know, tretinoin, retinols, these things help to increase production by decreasing breakdown. There's a whole discussion about whether or not taking oral collagen, you know, helps to improve the collagen in the skin. Some studies say yes, some studies say no. Some studies suggest that like your body said, you know, recognizes it as additional food and it's more broken down. But there are some studies that suggest there may be some benefit. But I can't say that it's 100%. And then there's also, other anti-aging things that you can do to kind of help improve the appearance of the aging skin. Right? So we went back, if you think back to the slide where it shows the muscles, that's where like neurotoxins, like Botox and Dysport are really helpful. Those lines that you make, from furrowing, the motion of the forehead, around the eyes, you can use it other places and they do cross over, but traditionally that's kind of how you think about it. And these last, 2 to 3 months, 3 to 4 months rather. And then there's dermal fillers. You think about the hyaluronic acid fillers, that these work by you inject it to fill the lines and fill the wrinkles and the folds. And so these are some options that you have to help, replace, mimic that lost volume that's there. But what we're talking about today is actually Sculptra. And honestly, I get pretty excited about Sculptra because it addresses this underlying cause of facial aging. It addresses this loss of collagen.
Look how happy she is.
I know, she got some Sculptra, so she's real happy about it. So Sculptra is polylactic acid. And so I like to tell patients it is akin to suture material. And when it's injected beneath the skin, it actually encourages a natural process to stimulate collagen. And so I have patients who are concerned about, what they're injecting under the skin and what's being placed. And I love to say that, Sculptra it's somewhat of a natural product in that after it's injected, when the body metabolizes and absorbs it away, what's left is your own natural collagen. So it's your collagen that gets stimulated.
Extremely exciting. I love that. All natural.
Yeah. And so, how does it work, right? So I describe it as laying seeds of collagen. When you're injecting it, there is it's a needle stick, it's a placement of this in these areas where you have volume loss. And you use it over the whole face to replace generalized facial volume loss. And I love that it has a super natural, subtle, it tends to avoid, kind of sometimes patients will say, I don't want that overfilled appearance. Well, Sculptra, because of how it works, and I'll go into this, but because it's stimulating your own natural collagen, it just has this very kind of creeps up on you subtle appearance. And I've had several patients come back to me saying, oh, my family asked me if I had a facelift. And, obviously they didn't, but there was this subtle improvement and restoration of volume loss that gave them a youthful appearance.
I love that. And that's why I think we mentioned it as kind of like laying the foundation or like the scaffolding of the anti-aging process, because it really is like an overall rejuvenation, not just a single aspect.
It's just so pretty. So pretty.
Love to hear that. That's what we want to hear.
Yeah. Okay, so here's some really pretty before and afters. This pretty lady, if you look at the before photo, you can, I like Sculptra in a patient who has significant areas of volume loss. So, it may be something that people's eyes are generally drawn to, like the area around the nose or the area around the mouth. But really and truthfully, she's losing volume in her temples. Her eyebrows are heavier. She's losing volume in her cheeks. Her chin is getting smaller. And then when you look at the after photo, you can see, it's one of those things you sort of look at it and you're like, she looks younger. She looks refreshed. She looks restored. But she doesn't look like she's had something done. It just looks so natural. It's just really pretty. And it's this, like I said, it's a very gradual process. It takes place over multiple sessions, which I'll go into again. But I just love the natural appearance of it. And here, that's it. Thank you. So here's kind of the side profile. And if you look at the before and the after, I wish they would have tucked her hair behind her ear in this before photo, because I have a feeling that she probably had some little crepiness there by the ear. I don't know, but that's one area that you can use Sculptra for, is to kind of soften that area of volume loss, in front of the ear. But just look under her eye, look around the smile line, look there kind of at the corners of her mouth. She just looks rested. I mean, her sweet little eyebrow is lifted. She just looks softer.
She does. She looks rejuvenated. I feel like it's one of those situations where she looks like she was just able to get some rest.
Yeah.
We can all use that.
I like to say you had some really good sleep. You went on a vacation and you only thought about brushing your teeth, not your kids' teeth.
Oh, I love that.
Yeah. All right. Here's some other before and afters. You know, this pretty lady, she had 4 vials over 3 treatments, and it'll show you in the next slide about the time frame, you know, that she had this. But look at the before and the after, right? She doesn't, I like to say she doesn't look stuffed and puffed, you know. She just looks softer. Look at the first photo. Look at the area under the eyes. Look at the hollowing. Look at her smile lines. And she doesn't look overfilled. And, you know, I go on and on about this stuff, you know, all the time at work, and, you know, talking to patients and sharing with them, like, why I think they should use Sculptra. The other thing, you know, patients will oftentimes ask me about like Sculptra versus this, and I'll hear this from patients. Sometimes patients will say, oh, I feel like my neurotoxin, my Botox or my Dysport is just not working as well as it used to. And they'll say, particularly around the eyes. But more often what's happening is they're losing volume in their temples. And if you think about the face kind of like a balloon, right, which is a terrible example, but if you think of the face like a balloon and a balloon loses volume, there's no amount of like Botox or Dysport that you can use to replace or to help that crinkling that occurs when a balloon loses volume. You have to restore the volume. And so that's why I like Sculptra, is that you can pick and choose and restore the volume where those areas of volume are lost to help restore. I'm not going to say facial balloon, but you know what I'm saying, right? It just helps to kind of lift and restore and soften where we've gotten gaunt or drawn, or we look, you know, tired. It's just so pretty.
It is. I have to say that this photo literally looks like this series looks like she's aging backwards. It's very interesting.
Yeah,
The
so
end
pretty.
and the beginning.
Yeah, so pretty. So I just love this before and after. I mean, she looks youthful, and from the before photo to the after photo, so youthful, so pretty. This pretty lady, when you go from the before photos to the after photos, I think what's most noticeable for this patient is particularly under the eyes. I mean, yes, you can tell like around the nose, the mouth, the jawline, you know, her temples. Look at her temples. Notice her eyebrow. Notice the lift in her eyebrow. Notice her jawline. All of these things in the before and the after photos. All of these things contribute. And so, you know, patients will sometimes ask about like the administration of it. And generally, you know, I like to start from kind of the upper face and work my way down, because once we kind of lift the upper face and, you know, work our way down, then you see that, you know, it can happen as a result when you're lifting that the, you know, the lower face is lifted, the neck is lifted, but it just helps to kind of help with that drape, right? Remember we talked before about the loss of collagen, that you lose the skin becomes drapey. This helps to support it. One thing, let's move on to the next photo, Taylor. One thing that to clarify, to be sure of, her eyes look softer, right? They look like she's had something done there, but Sculptra is not actually intended for the area under the eye. So it's basically restoring her cheek area that has softened her eye, and so made her look more youthful there. Sculptra is also not used for the lips, so we would use like a traditional hyaluronic acid filler if you wanted something in your lips. But this is just going to show like what a difference makes when you address the problem of volume loss in the cheek area, or really addressing volume loss over the whole face. Because sometimes patients will come in and they'll say, this area under my eye really bothers me. But when I start to kind of dissect it out and point it out, you can show them that it's really because they've lost volume over the entire face, and that's what's contributing to that hollowing under the eyes.
Definitely. And it's
I love this.
Yeah, that you mentioned, what's really great is that you can use the procedures like Botox or Dysport or fillers to like accentuate the results that you see from your Sculptra aesthetic visit.
Mm-hmm. Yeah, absolutely. So, you know, Sculptra, it does last, you know, 2 years at maximal correction. But with some maintenance, you know, I like to see patients back. Maybe we do a vial a year, you know, we kind of check in. And theoretically, the intent would be to sort of become ageless, and that we're not having to redo it every 2 years. You know, we check in and do a little maintenance work. But again, it's one of those things. It's just a beautiful, natural result.
Love to hear it. Okay.
Yeah.
So tell us what we should expect from our treatment.
Yeah.
Yeah,
So,
definitely.
so when you come in, we would love for you to be clean face, no makeup. Know that it's going to be pretty processed results that last. We typically administer 1 to 2 vials per session. I like to space my treatments out, usually about 3 sessions, spaced out about 6 weeks apart, but we also evaluate. The thing to know, because it's a journey and it's not instant gratification, it really takes a good like 8 weeks before you may see some improvement. So when I see you back after that first visit for the second placement, you're not going to see a lot. But by the time you come in for the third placement, you'll really start to see some collagen stimulated. And how it's administered. So Sculptra is like this little particulate that gets, I like to say it gets mixed in this fancy sort of water. And that's the water is the vehicle for delivering the Sculptra particulate. Remember I told you it seeds of collagen stimulation. And so when you leave, you're going to see like where we're going with the volume restoration. So it's not like we just inject the stuff and you don't see anything. Like you're going to see where we're headed. And so patients will always often say like, oh my gosh, I love this. And I said, yes, this is where we're headed. Keep this in your mind of this is where we're going, because that's the ultimate goal of the volume restoration.
You're playing the long game. We love it.
Yeah. Yeah.
Let's see.
Oh, and these are a couple of my favorites that I like for people to use along with, because, and this kind of goes to the aftercare. When you administer Sculptra, remember I told you seeds of collagen stimulation, you actually want to massage it. The recommendations are you massage 5 times a day for 5 minutes for 5 days. And so I always tell patients, when you wash your face in the morning and at night, you stop and you massage, right? You're already washing your face. So just kind of linger in those areas where you're washing your face. But then several times a day, take a few little drops of the HA intensifier, put it over your face and massage with this. This helps to increase the hyaluronic acid levels of your skin. It helps to improve the firmness. So when you're massaging, just, with that collagen, with the Sculptra to help those C's from, clustering, then you're also helped to improving that top layer of your skin as well. And so patients often will come back and say, oh my goodness, I love this HA intensifier, but it really helps to make the skin look more hydrated. And then C, ferulic, right? We talked earlier before, like, topical vitamin C helps to stimulate collagen. And so I can't live without my SkinCeuticals vitamin C. It's a good one. So I always apply that daily under my sunscreen. And there's a couple other vitamin C's made by SkinCeuticals, but my personal is C ferulic. And so that's why I gave it a shout out.
Love that. It's super important to make sure, you know what I mean? Like we mentioned at the beginning, sunscreen being pivotal in the aging process. And along with regular uses of sunscreen, dermatologists told you, make sure that you try out these products, which are a great way to protect your investment and kind of enhance the results on the surface of the skin as well as what you're doing on the inside, which is really exciting. Okay.
So, Taylor, that's pretty much it. Really, I would, welcome any questions anybody has. It takes about 30 minutes in the office, kind of start to finish. If you come in with a clean face, we talk about it and we discuss it and get it going. And but I know you'll get to this, but we do this across all of our Sanova offices. So I'm not the only one. I just happen to live at the Pflugerville and Steiner Ranch locations.
Yes. We love to hear it. A couple of these questions that are coming in, I'm about to read them to you. I do want to say, just to preface this, that consultation is key, which is why PA Jordan mentioned that we offer this at most locations, all locations in the Texas region, and some locations in the Louisiana territory. But that consultation is key because it's something that is going to be personal to your specific situation. So just know that although PA Jordan may answer the question, it's still super important for you to visit your local provider to decipher the best treatment plan for you. So here, my first question is, how many injections per visit and how long after injections will you see results?
So the number, so it's the number of injections that's really hard to answer because I'm really essentially focusing on the areas where you have volume loss. So I have some patients who, I'm going to talk about myself. So my temples are like the Grand Canyon. I can administer a vial of Sculptra to my personal my personal temples. I have Sculptra in my temples if you're not picking on what I'm throwing. But other patients, one vial covers the whole face. So I might be doing multiple injections, to the face. It just varies from person to person. And I'm sorry, Taylor, what was the second part of that question?
How long after you do your injections will you begin to see results?
It's really like 8 weeks. I mean, I don't know, maybe placebo effect. I noticed it sooner, but I was like hoping, but 6 to 8, 8 weeks really is when you start to see.
Awesome. We love that. That's great to
Yeah.
hear. I love that you have to kind of set expectations to know
Yeah.
when you're going to see those results. Someone asked, I understand that jowls can only be remedied via a facelift. Would you say that's true, or is Sculptra something that can help with that a little bit?
That is totally a consultation, see you in person kind of question, because sometimes your jowls are a reflection of what's going on in the mid face, the upper face, and the temples. I mean, again, that kind of goes back to the whole your face is a balloon theory. When the balloon loses volume, you need to restore the volume. Yeah, there are some patients who I will, we'll have a conversation and I'll candidly tell them, like, I feel like you would be a better candidate for, a facelift, and I'll give you recommendations that way. But no, not everybody who has jowls needs a facelift.
And I'm going to assume, so the next patient asked whether or not it would be appropriate for someone in their 70s. And something tells me you're going to tell me that you're going to have to come in for a consultation because everyone's going to be different.
Yeah, I would say that. But I have had patients in their 70s and even in their 80s loving Sculptra. So,
That is exciting.
Yeah.
I love that.
Mm-hmm.
So I've got someone here asking, can I have ongoing IPLs while receiving Sculptra?
Yes. I wouldn't do them the same day, but yes.
Oh, that's great to hear. Okay, so in the same realm, I have someone asking if I can combine filler at the same or in the same time frame as I'm doing Sculptra.
Right. So that's a good question. So sometimes, like, after we get your Sculptra maximized, I say maximized, but like once we get you, okay, good collagen stimulation, you're where you want to be, then you come back in and we're doing sort of your every 6-week visit. We'll reevaluate and then decide, okay, at this point, should we follow with an HA filler, those kinds of things. But, you typically don't inject Sculptra and hyaluronic acid filler in the same place, but it does happen where I might do a hyaluronic acid filler to the lip and then Sculptra elsewhere to the face at the same time. That can happen.
Fantastic. I love to hear that. Complement those procedures. Okay, so let's see here. I think we have time for just a few more questions.
Okay.
Here, sorry, I'm like working the board here.
It's okay. I'm gonna drink a sip.
Okay, I'm gonna give you just a break. We're gonna say it's you. So bruising. Let's talk bruising. Is that a realistic expectation? What can I expect?
Right. I bruise no matter what you pass at me. And some people are not bruisers, but if we're living, breathing, there's always a possibility of a bruise. It's a needle stick. And so I always encourage patients to account, for bruising. And give yourself at least 10 to 14 days. Don't do this right before a big event. But no, if we're alive and well, we're going to bruise. So it's just part of it.
Definitely. I think that's a great way to set expectations. A person asked, which I think is a very valid question, how is the discomfort compared to filler? And the same question about bruising. You kind of touched on that already, and swelling.
Say that one more time, Taylor.
I'm so sorry. So someone's wanting to compare it to filler, which I think is very valid. How would you say that it feels being injected versus filler?
Oh, that's a really good question. It just feels different because the hyaluronic acid fillers are more of like a gel. Whereas, remember I talked about Sculptra, it's this water, it's this vehicle that delivers the particulate, the little Sculptra particulate that stimulates collagen. And so there's a needle stick in both cases. Okay. And so you feel the needle stick, but it just feels different. I've had some patients say that it's not as uncomfortable as a typical hyaluronic acid filler. Now, lips, those are right. Those are always a little sensitive, but again, that's not Sculptra. But I'm just saying, if you could to compare lips to Sculptra, Sculptra's a breeze. But no, I haven't had anybody say like it was. Yeah, it's doable. Absolutely doable.
I love that. And then I have one more question for you before I tell everyone about
Yeah.
the exciting promotion we're offering. The question is it possible for Sculptra to cause permanent lumps?
Permanent lumps. Well, so a potential side effect of Sculptra is that the little seeds can cluster under the skin. But that is partly you want to make sure that you see a provider who knows how they're administering it. And that's why you don't administer it under the eyes. You don't administer it to the lip. You want to see someone who knows what they're doing. Because I have seen patients who've had lumps under their eyes where they've had Sculptra placed superficially or in the wrong plane. But the little seeds can kind of clump up. And occasionally I'll have someone who feels one and we can take care of it. But the massaging helps to prevent that, little seed or granule that you feel, but you can't see it. No one can ever see it. If you do, feel it because of the plane or the proper depth that it's been injected.
That's extremely helpful
they're
information.
not permanent, but they're not permanent. So remove the word permanent from that. So I think that's maybe what they're asking.
Definitely. And I love, and I want to double down on the fact that you said it really has to do with following the proper protocols about massaging, making sure you're going to expert injectors who know what they're doing, like PA Jordan and the other providers that we have injecting at Sanova Dermatology. That's extremely important. And also just making sure that you're going to those consultations, like we said. So I want to say thank you so much, PA Jordan. I'm going to start chatting about the promotion, and you're welcome to jump on if you'd like. But we really appreciate you and all the time you took today and sharing this amazing information about this foundational procedure.